Hey, this is Paulius, and you're listening to Voices of Table Rounds. This is another episode of our series on making connections in medical education with the goal of featuring really awesome individuals who contribute to our learning and help us grow as educators. Today, we have Dr. Michael Cosimini. Welcome to the podcast. And for those who don't know you already, tell us a bit about yourself.
Hey, thanks so much, Paulius. Well, my name is Mike Cosimini. I'm a pediatrician in Los Angeles, California. I am from St. Paul, Minnesota, and I am really like an enthusiastic educator. I love the role of podcasting in medical education, and I think that there's so much we can do with that. And I'm also working with games in education, which I think is why we're chatting today.
Exactly. And so speaking of games, you've created something really amazing that essentially I think brought us together because we share a passion of medical education, but also making it more fun for students. And your game is called Empiric. I've gotten to play the pediatric version of the game. I know you've come out with another one recently, but can you, for those who've never heard about the game, can you briefly explain what it is?
Yeah, so it's a deck of cards with antibiotics and with clinical vignettes based on IDSA and AAP guidelines for antimicrobial selection. It's really it's like a 20-minute card game that you can pull out in a little bit of downtime if when such a thing happens at work, and work on and do some repetitions learning those guidelines. It's really aimed at third year medical students on clerkship and pediatric residents primarily for that game that you're referencing. And we try to take what gamification, or I should say a serious game, can offer and kind of build in some stewardship into the mechanics of the game. So people that play that game are learning, hey, if I use amoxicillin, so forgive me. So hey, if I use ceftriaxone to treat that community-acquired pneumonia, then now I don't have my ceftriaxone card to treat meningitis. So we try to make the use of the mechanics of the serious game to teach good stewardship choices, as well as what the antibiotics are for some common important clinical vignettes.
It's really fascinating. I think it's such a clever concept, and creating games is not part of medical education curriculum. Have you had this background before, or what inspired you to make the game?
Yeah, I've done a lot of gamified sort of exercises and little tabletop exercises. I think there's a lot to be offered by using physical materials on the table. I know in medical school I had actually it was on my peds clerkship, one of the attendings taught with a Jeopardy game, and now that feels like sort of a old fashioned sort of way of using gamification in education. But I remember it vividly, and was very memorable experience as a medical student. And I had some attendings as a resident who had photos that they used as part of their teaching, just X-ray images printed on a piece of paper and brought to the table, and that really drew me in. So ever since I was chief resident, I've been using lots of experimenting with writing diagnoses on cards or photos of rashes and having residents sort them and match them and do all kinds of little exercises that you make up on the spot or, with a very minimal amount of preparation. I think that's a great way to draw people in and have an active learning experience and a very engaged learning experience, so that people don't just run away and answer a page and never come back.
I like that. Are there any other games out there that inspired you also to make this, or this is kind of your first exposure to games?
I definitely was making some little ones on my own, but then what got me to dig in and like really make it happen was seeing GridlockED, which Dr. Chan from McMaster's, like just beautiful piece of like a board game to teach ED workflow and communication strategies, and there's so much there. But I saw their publication in academic medicine. Like, oh, like this can really be done, and I actually got a chance to like talk with her on the phone kind of early on and get some mentorship and inspiration from her. So that's what made me think like, oh, I really could take this to a product that I let other people use instead of just making a card game for my own purpose, which is what I'd been doing for years before that.
Exactly. I completely agree. I think that paper is really awesome, and we'll be sure to include it with our podcast. So I'm sure people who are listening to this might be curious how to get started in making something like Empiric. Can you just tell us about the process that you went through? And I know it may not be for everybody, but just how you went from the idea stage to now actually making it available online for purchase.
Yeah, I'm not sure I would recommend like the path that I took to other people. I think I've learned a lot in that and made a lot of mistakes. So you should probably learn from my mistakes instead of repeating them. Because I really was like, oh, cool, you can get cards printed on the internet, and just printed the names of antibiotics on cards. And, I dropped like hundreds of dollars iterating in sort of disorganized and random fashion. So I'm not sure I would recommend my way. But what I would say is like, if you want to try making a game, there's a pretty low bar to start, and like getting some 3x5 cards and writing words on those 3x5 cards and getting them in front of learners right away, and experimenting and just using cards with words written on them to teach to your strengths as a teacher and the content that you want to deliver, I think is a really great way to start. I think, if you're making a game, keeping it as simple as possible is really ideal for the educational setting. You really don't want extraneous rules and complicated rules, and you don't want a lot of your learners' mental energy going into the rules of the game. You want their energy going into what content you're trying to teach or what the mechanics of the game are trying to teach. So I think, keeping it simple, trialing it early are probably the two most important things I would say I've learned from my experience. My game was complicated at the beginning, and it has been cut back over iteration after iteration after iteration. And in fact, it's been simplified since the PEDS version that you have. The emergency medicine version is a little bit simpler. And I mean, there's jokes to be made about emergency medicine doctors there, but really it's just better game.
I think making things simple is certainly an art. And I think, just in medicine, if to present a complicated patient, it does take a more skill to make it a concise one-liner statement that summarizes all the pertinent details than just ramble on for a few minutes and try to pull in all the things that are relevant. So I completely get what you're saying, that making it simple actually takes more work.
Yeah, what's the phrase? I didn't have time to write you a short letter, so I wrote you a long one.
Yeah, that's right. Awesome. So and in terms of the time frame that it took you to create it, was it over a year, multiple years, or just a month's type of period?
I think it was about 2 years from the first prototype that I printed for myself to when I released it for other people to purchase. And then honestly, there's been quite a bit of iteration since that initial version was released. So yeah, the scale of years I think is mine. And I think if you're actually going to be selling something that's like a finished product, that's probably what you would expect to do.
Yeah, that from my experience, for us, it's been about 2 years. Also, it's just it takes time to pull all the pieces together. And I think the reason I'm asking this question is just it's helpful for others to hear, to get their expectations, I think in the right setting.
Yeah, but you could download like if you go to if you like Google cards against pediatric dermatology, or if you go to MedEd portal and search for games, there's a lot of games you could download and print today and use tomorrow for your teaching, right? So making your own game might take a while, but there's a lot you could try tomorrow. And something simple where you just print some pictures and have your students sort them by what type of rashes they are, or sort the developmental milestones by the age the kid can do them. There's tons of things you could do, you could put together tonight and teach with on rounds tomorrow. And I think if you're thinking about making a game, that's what you should be doing.
Yeah, so actually speaking of this, I think this kind of leads into the next topic of our conversation is what can you offer that you've learned about using games in medical education for the benefit of trainees and also their educators?
There's a lot of ways to deliver content, like educational content to students, whether that's talking at the whiteboard or seeing a patient or giving a lecture or a podcast or whatever. And I think that games offer kind of an active learning technique. They're not the only active learning technique, right? You can have a discussion with with your students. You can use PBL strategies. There's other ways to do sort of active learning, but I think games are an easy way to implement an active learning schedule strategy where students are forced to think and recall information and use the knowledge that they have. So I think that's one benefit that games have in any educational setting. I also think there's like something about engaging with your students in a game that is beneficial to your relationships. Um, we're like super tight on time, right? Generally speaking, for teaching in the medical setting right now, there's a lot of clinical responsibilities. Like one of the things that I do every time I come on service is I have like all of my students and residents give like their own one-liner to introduce themselves to the team, like where they're from and what not medically that they're into. And I think that strategy is really important to like build those relationships between learners and between the learners and between the learner and the attending. So I think that's one strategy that I use, but I think games also kind of play into that same like environment, that it's a little bit, if you could do it right, you can do a little bit lower stress kind of interaction, lower stakes sort of interaction than family centered rounds, where people have a chance to get to know each other a little bit better. And I think teaching with games has that value as well. Like it's like relatedness to think about it like in a social self-determination theory kind of way.
Exactly. And then, I mean, it also gives students a chance to continue that learning in a group setting collaboratively, you know, after their clinical experiences. I think it's a win-win really all around.
Yeah, it is a win-win, but I think there's something to be said about efficiency, right? So like I don't always use games for teaching. It's like one strategy that I use. And I always sort of like kind of consent the residents into the concept of using a game. I always ask before we play, hey, do we want to do something at the whiteboard, or do you want to play this card game or use this, you know, look at these derm cards or something? I do think like there's sometimes I think a bias against use of games for education and active learning techniques in general, that people might think they're learning more if you're giving a lecture, especially if you're good at giving a lecture. Even though they're maybe not retaining as much from that kind of method. So I do think it's good to kind of, you know, get the residents buy-in up front before using a game for education and make it clear like, hey, we're going to use this active technique and it's going to help you learn X, Y, and Z, and kind of just like frame it that way, because I think there's a little bit of risk that people are going to think this is an inefficient way to teach them, or you're not making good use of their time. So I think you got to kind of make the sale that this is a good use of their time.
Yeah, I think at least my experience with some games is that to me, it's almost like it's a separate experience than a didactic. I don't necessarily use it to replace the core curriculum that a student would receive. It's more to supplement and maybe enhance their mental well-being factor by having something pleasurable that the group can do together to build cohesiveness. At least that's, I mean, how I think about it.
I think we're getting at the fact that we have made two different games that are actually really for very different purposes, though, despite them both being cards on a table, right? Like your game, to me, in some ways could replace an icebreaker. Like instead of doing that icebreaker where we introduce ourselves, we play this game together and bond, but we can't walk into table rounds with a specific educational goal because the mechanics of the game are not set up to make a very specific educational goal. It's for us to teach each other and to make some interesting connections between different concepts. But I can't say we're going to do table rounds and by the time we're done, you're going to know X, Y, and Z about asthma.
Yeah, that's exactly right. You might not even get to asthma, even if you have all the respiratory cards.
Right.
Yeah. Okay, that makes sense. What do you think about the idea? I've read this. I feel like this is experientially true. That when people engage in this heightened emotional state, they tend to retain things better in some way. Do you feel that from your experiences playing Empiric, for example, with students, do you feel like you retained something that is medically or clinically useful that otherwise you would have forgotten?
I think that's a question that we should test, doing transfer and retention kind of questions on people who've played a game versus had to deliver it in another fashion. I think that is consistent with the larger literature that active learning techniques are going to have people retain information better, but it's not something I could even say I've quizzed my residents months later on the content just informally and seen what they've retained. I did have one of my students found me on Twitter and said he remembered that Dogmentin or Augmentin for dog bites. He had retained that. So I have one example, but But yes, I think it's a good way to learn, but I'm not capable myself of proving it.
I like that. So, okay, so we've been talking about learning so much. We should pick your brain about, as you've advanced through your training, med student, resident, now attending. Do you have any insights how your approach to learning has evolved through this transition?
Well, I'm so glad I don't have to go back to like preclinical medical school style learning, because I don't think I was particularly efficient at it, and I think it's like very, it's so difficult to find out what you actually need to know for yourself to be a clinician in the future. Now, I mean, the bulk of my learning is through teaching, right? Like the best way to learn is to prepare things for other people to learn, to get ready for rounds by pulling some articles, so that when you see that asthma patient with the team, you have one or two learning points you can share with the residents, and the person who's going to remember those best is actually you, the teacher. So I think at this point in my career, almost all of my education is around either development of this game, development of podcasts for educational topics, but most importantly, reading up on the particular clinical patients that I see. I mean, it's like, you read the up-to-date article when you're a student, right? I advise my students, go pull the up-to-date article on the chief complaint that you think this patient has, quick scan through it for what questions you're going to ask, go in there, ask those questions, and you're going to learn a lot more by reading a little bit about the topic before you go in the room, and then again after you go in the room, than any other way of seeing that patient.
Very true. The next question is a bit, maybe unfair because it's so broad, but, can you think of your most memorable advice that you've been given as a learner?
I've gotten some memorable advice, though I don't know if any of it was actually about learning. I think the best advice you get as an early resident is not to take anything like what do we say, like trust but verify, like to like get the information yourself, look at the chart yourself, ask the history question yourself, and don't like pass forward information that you got secondhand, because one, like that information may well be inaccurate. What you heard from your overnight resident, they might be wrong or confused, or there might be like loss of signal in that sign up period. So getting the information directly from the patient, from the nurse, from the chart is really important. I think that is good for just being accurate, but it's also good for you truly comprehending what's going on. You hearing secondhand that the patient had belly pain overnight is not the same as you asking the patient what they felt. So I think that was memorable advice. I'm not sure if it's exactly learning advice.
I think that applies. I think at least personally to me, it's informative, and I'll keep this in the back of my mind. So I appreciate it. Thank you. I also like to, pick your brain about different learning resources, because as you know, you're pretty active on Twitter, and online medical education communities like MedTwitter have really changed the way we share information and exchange knowledge. I'm curious if you use anything, fancy that maybe the rest of us, the peasants, don't know about. Is there any particular resource you feel like we should keep on our radar to include with our teaching resources and learning resources?
I think realistically, like most students are ahead of faculty in terms of like what the cutting edge resources are, and what we should be using. I mean, I wish I had gotten like flashcard apps when I was a student. I think those are like I don't think I would be downloading decks that other people made, but now, like if I was a student that had access to it, I definitely would use a flashcard app to build a deck of questions that I needed to learn, and what I saw as my goals, whatever questions you're getting wrong in the question bank, or whatever learning points you think were most important from the cases you've seen. I've actually kind of incorporated flashcard apps, Anki, into my practice, but it's actually, between you and me, I have a picture of all the interns, their photos and their names, to learn names, because we have a huge class of residents here, and it's really hard for me to learn names. So I did that this year, and it was super helpful. Other tools, I love diagnostic support tools. I think are actually helpful for education. I'm not sure if they're super useful as like a medical student. No, they probably are. Like I like diagnostic aid tools for like wrapping your head around what you should be thinking about with the given case. Visual DX is nice. Like you poke in like its papules on the hands, what causes that sort of distribution of rash in this age person, and then it shows you a bunch of pictures. You can kind of say, oh, it's this, it's not this. And I run that with a student when they present a rash to me. I'll put what the findings they gave me into Visual DX and then talk through why it is or isn't one of those pictures. So I think that's a really good one. I also use a software called Isabel, which is it's another one where you put in the age and the clinical findings, and it gives you a differential diagnosis to think about. And once or twice that's come up with some really clutch diagnoses for me. But often what I do is we'll run that as a group on the wards and say, why is it this diagnosis? Why is it not this diagnosis? What do we think about what the computer is telling us? And I think it's a good jumping off point for discussion.
That's awesome. I've not actually heard of Isabel, so thank you.
These are both subscriptions, so you may or may not have access to them through your institution.
The peasant life. Okay.
Yeah. But maybe you're young. Maybe you know how to like I don't know whatever LimeWire is for people your age.
That's funny. No, I think I use Spotify. I'm just $5 a month or whatnot. It makes sense for a service that you use a lot.
I heard Golgin's on Spotify now too.
Oh my gosh. Okay. The times are changing. All right. So something I like to close with is hearing your impression about table rounds. You're clearly familiar with what our game is, and just wanted to, hear your take on maybe your first time that you learned about the game and what you thought of it, and then what you actually thought of it when you saw it in action. And just curious, what you have to share with us.
I'm pretty sure I encountered it on Twitter. That seems like most likely, just seeing the pictures. I mean, it's a very nicely, attractively packaged product. And I have to say, I clicked through the webpage and I wasn't really sure what it was, but I'm like, I'm buying this anyways, right? Because it's like a meta tabletop game. It absolutely needs to be in my office. And then using it, I've had a lot of fun. And I think that's probably the right word, like fun using it. Just taking it out with an attending and just playing for 40 seconds, even hey, match these as quick as you can, and racing and laughing and saying why the other person's wrong. It's a lot of fun to just sort of match those cards and argue about them, and occasionally see things on the cards like ARBs that I don't think I've ever seen prescribed because I'm a pediatrician and I don't really know what they are. But also some, all the kind of core lab findings and clinical findings that we have to deal with. So, I've really enjoyed kind of engaging with it in brief periods, sort of in those little snippets of downtime, hey, let's quick play the game. I used it on wards. I think the last time I was on service and played briefly, sort of, it's kind of a winding down exercise on a busy day. Hey, let's just steal 10 minutes to chill. And it worked pretty well like that too.
Really cool.
People get competitive though. People get into it.
Yeah. It's I've just had such varied experiences with everybody. It depends on who's in the crowd. Some people need to be nudged constantly because everybody's shy, and other people need to be just kept apart because they're too intense, Okay, well, this is really cool. I'm glad that you're putting it to use and infusing some playfulness to people's educational experience. I think that's one of our goals, certainly. I've learned a lot by talking to you about, medical education, Empiric, and hearing you reflect about all of your experiences. Do you have anything else that you would like to add, or can you tell us more about kind of the recent game that you've developed, the emergency medicine version of Empiric?
Well, the emergency medicine version of Empiric is just kind of pulling out some adult cases that I felt were important to teach on, some covering some possible misunderstandings people might have about the use of antimicrobials in that setting. It's a simplification of the original PEDS version. I dropped it from 90 to a 54 card deck, and that makes it a lot simpler to make things run smoothly. So that was a lesson I had from the feedback on the first version of the game, and also actually simplified the rules a little bit. So I really think there's always room to keep iterating. And I think one thing I would also bring out of this, if someone is trying to make their own game, what I'm doing is a print on demand model, which is to say, I send a PDF of the game to a company and people purchase it. And when they purchase it, a copy is printed and sent to the person. So when I find that there's a typo or someone updates a guideline, or I get feedback that something was unclear in the rules, I'm able to update those files and within about a 2-week period, make a new version of the game to address those concerns. So I think if you're making your first game that you're going to be selling to other people, the print on demand model like I'm using and like is used in GridlockED is a pretty good way to go. It's also no financial risk, right? Like I probably spent a few $100s on copies that got sent to me, and then maybe another couple $100s on copies I sent to friends and people who helped me design it. But you compare that to ordering, 500 to 1,000 copies and getting them shipped across the ocean. It's quite a bit of a better low risk way to go for developing a game.
That's very true. And, you and I have created a Slack group for game-based learning and medical education. And this is the kind of stuff that we share, tips, resources. We try to collaborate, work on papers on shared interests, and put together workshops. So if, we're always looking to pull in people with similar interests. I mean, I feel like even recently we've just been discovering other people, posting their own medical games online, and they have been kind of joining our group. And I think this is something that's growing organically. So I think this is another opportunity to get involved, and we're just trying to create a community that will make it a fun experience for everybody.
Yeah, and if you're looking for like a faculty development kind of workshop, or for your education track students or anything like that, I think find me or Paulius online, and we can maybe set something up for you too, to teach this content and kind of share a little more expertise, because we'd like to evangelize. What's the word? We would like to get more people doing this, because I think it's a good educational strategy, and I really want them on my shelf. So please make them.
That's very true. All right. Well, thanks so much for your time, Dr. Cosimini. It's been a pleasure talking to you, and we'll catch everybody next time.
Thank you so much. Have a good one, man.
Thank you for listening to our episode. Highly recommend that you check out Dr. Cosimini's game Empiric on his website. We'll put a link in our show notes. Also encourage you to go to playtablerounds.com and get a copy of our game. You can also check out our social media, particularly Twitter. We put out a lot of live challenges that you can participate in, and we look forward to learning collaboratively. And stay tuned until our next episode.